Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about a second finding that we see in your second trimester anatomy scan that is technically considered abnormal, but usually doesn't amount to anything if we don't see any other abnormalities during that scan. This video is going to be about a two-vessel cord or single umbilical artery. And if you want to know about the other two abnormalities, please go ahead and check out my videos on those. Oh, and if you guys are interested in joining a like-minded community of supportive, expectant, as well as current moms, please look in the link in my bio. I did go ahead and form a group for us to go ahead and hopefully talk freely, as well as if you guys have any questions, please ask them over there so that I can actually answer you guys in the best way possible, instead of fighting this TikTok character count nightmare that I tend to encounter when I am trying to answer people's questions on here. Anyways, a single umbilical artery or a two-vessel cord is something that is seen in about 1% of pregnancies. So it's not super common, but it's also not something that we rarely see. All right, so let's go ahead and take a look at a visual depiction of what I am talking about. This picture up here, as well as that picture over there on this top end of the pictures, are going to be what is considered normal, as opposed to these two down below here are abnormal. So in a normal pregnancy, what we are seeing here is one vein and two umbilical arteries that make up the umbilical cord. This cord here is just seen as like free floating cord, and we are seeing it in a short axis, as opposed to the one over there that is actually the cord going into baby and around baby's bladder. So the umbilical vein here, there is only one umbilical vein, and that is responsible for taking oxygenated blood from mom/the placenta into baby. These two arteries here are called your two umbilical arteries, and those are responsible for draining blood from baby into mom's placenta. You can appreciate in this short axis here of this normal three-vessel cord that there are three vessels that make up the cord, hence the name 1, 2, 3, three-vessel cord. And over here on this nicely labeled image, you can also see that this is baby's bladder, that is that dark circular area here. And the cord is going to be coming in from baby's abdomen on that side of the screen, and then the two arteries are going to be wrapping around baby's bladder in kind of like a fork shape like this. This is the bladder here, and then the two arteries are wrapping around the bladder in this sort of fashion, just right around the bladder. On the other hand, though, when we are seeing just one umbilical artery instead of the regular two umbilical arteries, the umbilical cord in short axis is going to look like a two-vessel cord, as in there are just two vessels that make up the cord. So here you can see just two circles that make up the cord instead of the three that you are seeing up there. Circle 1 is going to be the artery, and then the circle 2 with the V beside it is going to be the umbilical vein. And here it is just depicting the single umbilical artery or two-vessel cord going into baby. So here you can see this is just the one umbilical artery on this side of the bladder. And again, that bladder is just that dark circular thing. And instead of having another one wrapping around the bladder on the other side, so instead of it going like this on either side of the bladder, and again, bladder would just be right here, it is only one that is wrapping around on this side. So again, that is a single umbilical artery instead of the two umbilical arteries that we were seeing in the top picture. So with a single umbilical artery, there is a slightly increased chance that baby will have some growth issues in the third trimester, as well as a slight increase too of having kidney and heart defects. Because of this, we are going to usually do a third trimester growth scan to ensure that everything looks okay in the third trimester, especially in terms of growth. And it is also associated slightly with a higher risk of having a underlying chromosomal abnormality, such as trisomy 21. So it is also important for your doctor to check and see if your genetic screening came back okay, if this is seen on your second trimester ultrasound. But for the vast majority of cases, this is not going to amount to anything. Usually baby goes on to be healthy and the pregnancy is not impacted at all in a negative way. And after birth, these vessels do shrivel up and shrink away. So therefore, there aren't any long-term implications after birth. So if your doctor has told you that baby has a single umbilical artery or two-vessel cord that was seen in the second trimester, but there is no other abnormalities present and you had a low risk for your genetic screening, usually this is going to be nothing that you need to worry about, and if anything, you will just get a scan in the third trimester to ensure that everything looks okay there in terms of growth. But try not to worry if this is what your doctor has told you that baby has. Again, in the absence of any other abnormalities, it usually amounts to nothing.